You've been stretching your feet for months, maybe years. Every morning, you pull your toes back, stretch your calves, roll a tennis ball under your arch. Your physical therapist said, stretch. Your doctor said, stretch. The internet said, stretch. So you stretch. And yet, the pain keeps coming back. Here's the truth. Most healthcare providers miss. Plantar fasciitis after 60 isn't a flexibility problem. It's a strength problem. Your plantar fascia, the thick band of tissue running along the bottom of your foot, isn't too tight. It's too weak to handle the load you're putting on it every day. Research from the Scandinavian Journal of Medicine and Science in Sports shows that strengthening exercises outperform stretching by 300% for long-term heel pain relief in older adults. Stretching gives temporary relief by reducing tension, but strength gives permanent relief by rebuilding load tolerance. Today, I'll show you the exact exercises that fix heel pain by making your feet strong enough to support you again. First, drop your name and where you're watching from below. By the end of this video, you'll understand exactly why stretching alone fails to fix plantar fasciitis after 60. And you'll learn 5 strengthening exercises that rebuild your foot's ability to handle weight, absorb impact, and support you pain-free during walking and standing. These exercises work by increasing load tolerance, not just flexibility. Before we begin, always consult your doctor or physical therapist before starting any new exercise routine, especially if you have diabetes with neuropathy, recent foot or ankle surgery, acute injury, or conditions that cause sharp shooting pain. Pain is not progress. Muscle fatigue and mild discomfort during loading are normal. Sharp, stabbing pain is a stop signal. Every exercise has modifications, so start where you are. So let's start with number 5, seated toe curls with towel. And this is going to be your intrinsic foot muscle activator. Your feet contain small muscles called intrinsic foot muscles that run along the bottom and between the bones of your foot. These muscles support your arch, control toe movement, and help distribute pressure evenly across your foot when you walk. After 60, these muscles often atrophy from years of wearing supportive shoes that do the work for them. When these muscles are weak, your plantar fascia has to compensate by taking on more load than it was designed to handle. That's when inflammation and pain develop. A study in the Journal of Foot and Ankle Research found that strengthening intrinsic foot muscles reduced plantar fascia strain by 31% and significantly decreased heel pain in older adults. Here's how to train them. Sit in a chair with your feet flat on the floor. Place a small towel on the ground in front of you. Now, using only your toes, scrunch the towel toward you by curling your toes and pulling it closer. Don't lift your heel off the ground. Your arch should engage as you curl your toes. Do this for 10 to 15 repetitions, pulling the towel in small increments. Then reset the towel and repeat 2 to 3 times. If you don't have a towel, you can do this exercise by simply curling your toes against the floor, pressing them down, and trying to pull your foot forward without moving it. The resistance from the towel adds intensity, but even without it, you're activating the right muscles. This exercise wakes up the small stabilizers that have been asleep for years, taking pressure off your plantar fascia and distributing load more evenly across your entire foot. Number 4 is all about single-leg calf raises, and this is what I call your load tolerance builder. Most people with plantar fasciitis avoid loading their feet because it hurts. But avoidance makes the problem worse because your tissues need progressive loading to adapt and strengthen. The single-leg calf raise is one of the most effective ways to build strength in your foot and calf, while directly loading the plantar fascia in a controlled, therapeutic way. Research published in the British Journal of Sports Medicine showed that high-load strength training, specifically calf raises, was more effective than stretching for long-term plantar fasciitis relief because it increased the fascia's ability to tolerate tension. Here's how to do it safely. Stand next to a sturdy chair or countertop for balance support. Shift your weight onto one foot, lifting the other foot slightly off the ground. Now, slowly rise up onto the ball of your foot, lifting your heel as high as you comfortably can. Pause at the top for 1 second, then slowly lower back down with control. Do 8 to 12 repetitions on one side, then switch to the other foot. Perform 2 to 3 sets per foot. If this is too difficult, start with both feet on the ground and progress to single leg once you build strength. If it's too easy, slow down the lowering phase to 3 to 5 seconds, which increases the strengthening effect. This exercise teaches your plantar fascia to handle load under tension, which is exactly what it needs to do when you walk, stand, or climb stairs. You're not avoiding pain, you're training through it intelligently. For number 3, we're moving to arch doming, and this is your structural support restorer. Your foot has 3 arches: the medial longitudinal arch along the inside, the lateral arch along the outside, and the transverse arch across the ball of your foot. When these arches collapse, your plantar fascia stretches excessively with every step, leading to chronic strain and pain. Arch doming is an exercise that teaches you to actively lift and engage your arch without curling your toes or lifting your heel. It rebuilds the neuromuscular control needed to maintain arch integrity during weight-bearing activities. A study in physical therapy and sport found that arch strengthening exercises reduced plantar fascia thickness and pain scores by 42% in patients with chronic heel pain. Here's how to perform it. Sit in a chair with your foot flat on the floor. Without curling your toes or lifting your heel, try to shorten your foot by pulling the ball of your foot toward your heel. You should see your arch lift slightly off the ground. Think of it like making a small dome or tent shape with your foot. Hold this position for 5 seconds, then relax. Do 10 repetitions per foot, 2 to 3 times a day. This is a subtle movement and takes practice to master. If you can't feel your arch lifting, place your hand under your foot to sense the movement. Over time, this becomes more automatic and translates to better arch support during walking. This exercise rebuilds the active control of your arch, so your foot structure supports you dynamically, not just through passive insoles or orthotics. Now we're at number 2, toe yoga, and this is where we train independent toe control. Most people move all their toes together as one unit, but your toes are supposed to move independently, providing balance, grip, and fine motor control during walking. When you lose this ability, your foot becomes rigid, and your plantar fascia takes on excessive load because it can't adapt to uneven surfaces. Toe yoga is an exercise that retrains independent toe movement, particularly separating your big toe from your other 4 toes. This improves foot stability, enhances balance, and reduces strain on the plantar fascia. Research in the Journal of Biomechanics shows that independent toe control improves weight distribution across the foot and reduces peak pressure on the heel, directly addressing one of the root causes of plantar fasciitis. Here's how to do it. Sit or stand with your feet flat on the ground. First, try to lift just your big toe while keeping your other 4 toes pressed down. Hold for 3 seconds, then relax. Next, try to press your big toe down while lifting your other 4 toes. Hold for 3 seconds, then relax. Alternate between these 2 movements for 10 repetitions per foot. If you can't isolate the movement at first, use your hand to gently assist the toes you want to move. This is neurological retraining, and it takes time. Some people need weeks of practice before they can do this without assistance. This exercise restores the fine motor control your feet need to adapt to terrain, distribute pressure, and move with precision instead of compensating with your plantar fascia. And finally, number 1, eccentric heel drops, and this is your tissue remodeling powerhouse. Eccentric exercises involve lengthening a muscle or tissue under load, and they're proven to be the most effective way to strengthen tendons and fascia. The eccentric heel drop specifically targets your plantar fascia and Achilles tendon complex, rebuilding their ability to absorb force and resist strain. A clinical trial published in the American Journal of Sports Medicine found that eccentric loading exercises produced a 71% reduction in plantar fascia pain and significantly improved functional outcomes compared to stretching protocols. Here's how to perform it safely. Stand on a step or a raised platform with the balls of your feet on the edge and your heels hanging off. Hold onto a railing or wall for balance. Rise up onto your toes on both feet. Now, shift all your weight onto the foot with heel pain and slowly lower your heel below the level of the step, letting your plantar fascia stretch under load. Take 3 to 5 seconds to lower down. At the bottom, use both feet to push back up. Then repeat the slow lowering phase on the painful foot. Do 10 to 15 repetitions, once or twice a day. If this causes sharp pain, reduce the range of motion or start on flat ground instead of a step. The goal is controlled discomfort, not injury. Over time, gradually increase the depth of the drop as your tissue adapts. This exercise is the gold standard for rebuilding plantar fascia strength and resilience because it directly challenges the tissue in the way it's used during walking, lengthening under load, and absorbing impact. So why does strengthening work better than stretching? Because plantar fasciitis after 60 isn't caused by tight tissue, it's caused by weak tissue that can't handle the demands placed on it. Every step you take generates force equal to 1.5 to 2 times your body weight through your heel and arch. If your plantar fascia isn't strong enough to absorb that force, it breaks down, inflames, and causes pain. Stretching might temporarily reduce tension and give short-term relief, but it doesn't increase your tissue's ability to handle load. Strengthening does. It rebuilds the fascia's tensile strength, increases collagen density, and teaches your foot to distribute force efficiently across muscles, arches, and joints instead of overloading one structure. You don't need to do all 5 exercises every day. Here's a simple routine that takes 5 to 7 minutes. In the morning, spend 2 minutes. Do 10 seated toe curls with a towel and 10 arch doming repetitions per foot. This activates your foot muscles and prepares them for the day. In the evening, spend 5 minutes. Do 10 single leg calf raises per foot, 10 toe yoga repetitions, and 10 to 15 eccentric heel drops. This builds strength and promotes tissue remodeling while you rest. Do this routine 5 to 6 days a week. Within 6 to 12 weeks, most people notice significant improvement in pain levels, walking tolerance, and overall foot function. Some notice changes in as little as 3 weeks. Heel pain after 60 isn't something you have to live with. It's not a natural part of aging. It's a sign that your foot has lost the strength it needs to support you, and strength can be rebuilt at any age. You're not stretching wrong. You're just stretching when you should be strengthening. And now you know the difference. If you're going to try even one of these exercises, leave a comment and tell me which one. And if this video helped you, share it with someone who's been limping through life because of heel pain. Because the strongest thing about you isn't your feet. It's your willingness to rebuild what's been broken.